Hello, the reason I'm making this video today is I hope to give some of you out there that have been suffering from cardiovascular and heart disease a little hope. Maybe what I've discovered can be of some benefit to you. Now let me give you some background. I've had advanced cardiovascular disease going back about 12 years when I had 2 stents put in my heart. And I have a family history of heart disease on both sides of my family, so genetically disposed, I guess you'd have to say, is where I find myself. I have a brother that have the same situation going on. But as I've been downward spiraling, and I'm on 4 different medications, blood thinners, take aspirin, take high blood pressure pills, just on and on. I've also regressed to the point that I've been taking 100 nitrate pills a month. Yes, every month I go through about 100 nitrate pills, and I worry about running out at that point. There's some nights that I can't make it through the night without taking 4 to 5 nitrate pills from severe angina, chest pain. No energy. I have to have the house temperature at 80 degrees. If it goes below that, then I start having a attack of angina. The same way with going outside. I've been restricted to going outside if the temperature is above 80 degrees or below about 80 degrees. And just a lack of energy, my ability to do work around the yard, to just basically participate in life, had been reduced to sitting in a chair. And at be 73 years old in March. So a person could say, well, you've had a nice long life for somebody with heart disease, but I never give up looking for a possible way out of this. Lots of praying, lots of pleading with God. Is there any way I can get through, get better here? The cardiologist, I go to him every few months, and nothing. Well, this is, we're managing the symptoms as best we can. That is until, through my own research, I came across this article, and it's labeled, "Can Cervical Spine Instability Cause Heart Palpitations and Blood Pressure Problems?" And I might add other problems associated with your heart. And I'm looking at this, and just the light bulb went on. Now, a long time ago, back in 1968, I believe it was, I was working for an aircraft manufacturing plant while going to college, just out in a factory. And a day come along that I was running up some steps, and I was just looking down, I guess, at my feet, not paying any attention. And what had happened was a crane operator had basically covered off the top, where I could enter into the second story with this big steel plate, because they were moving sections of an airplane around. And I hit that square on with the top of my head as I'm looking down. And knocked me for a loop. The company sent me to the company doctor, and they gave me some muscle relaxing pills, and a couple days later I was back to work because I was young, and loose and full of energy in life. Well, over the years, my condition regressed, like I said, starting about 12 years ago, when I started having chest pains, and I ended up having 2 stents put in my heart. And from there, it's been a downward spiral, more medications, trying this, trying that, lots of, cardiograms. 4 different times they've gone through my groin up into my heart to see if there was anything going on that they knew, because I was having heart palpitations, rapid heartbeat going down to 30, 40 beats a minute. Just like almost instantly jumping all over the place. And again, the severe heart pain, no energy, just all the symptoms, that come with advanced the diagnosis of advanced heart and cardiovascular disease. Until again, I ran into this article, and it says, Can cervical spine instability cause heart palpitations and blood pressure problems? It was written by a Ross Hauser, Hauser, from Caring Medical, Florida. It's a 16-page report, and the light bulb went on, because that injury I'd had, I want to show you, this is me sitting, and you can see my head is forward. Well, it's not as far forward now since I started doing neck exercises, lots of loosening neck exercises that I haven't had neck pain, but I started doing all of this based upon a chiropractor that I watched on YouTube, that said, well, for neck, adjusting your neck and getting rid of this hump in your back, which I've developed over the years, different exercise for that. And all of a sudden, after a few days, I wasn't taking angina medication. I was making it through the whole night without sleep. Right now, the temperature in here is about 65 degrees. No problems at all going outside, no problems at all. My energy level has come back, and my heart instability has stopped. My pulse is about 10 beats per minute lower than it had been on sort of an average, because it just jumps around. It doesn't jump around anymore. It's down. Well, it speeds up as I do activity and slows down, and my body seems to be having more circulation. My skin is a lot warmer. I could feel, even when it's cold out, I could feel the warmth of my skin. So what I believe has happened is that the exercises have affected this nerve, this is called a vagus nerve, which is in your neck, and this controls your blood pressure, your heartbeat, a lot of areas of your body that I hadn't even considered. And what was amazing to me was neither of my cardiologists over these years ever asked me the question, Dwight, have you ever had a cervical injury, anything like that? Yes, I have. And they might have diagnosed it. Well, if you go to a chiropractor or you start doing exercises, maybe we can stabilize the symptoms of your heart, and you can have basically a full life again. So I wanted to pass this on to you guys again. Again, the article is, Can Cervical Spine Instability Cause Heart Palpitations and Blood Pressure Problems? And I might add lots of other issues having to do with hormones and everything that are controlled by our brain, our nervous system. It's not always just the heart disease that's the problem. It very well could be a nerve issue going on with you. So I hope you guys have a great day, and I hope that you look into this. If you have heart disease, if you're experiencing the symptoms that I have, I'm not a medical doctor. Don't take this as medical advice. Just look into it. It might be a solution for you. Have a great day.